The time is now for the American people to speak up. At a time when the American healthcare system is deeply broken, we are the only major country on earth not to guarantee healthcare to all people. We pay the highest costs. Trump's big, beautiful bill will make that situation in healthcare even worse. As a result of that legislation, 15 million Americans will be thrown off of Medicaid and the Affordable Care Act. Studies from Yale University and the University of Pennsylvania suggest that when you throw 15 million low-income and working-class people off of the health care they have, some 50,000 Americans will die unnecessarily every single year.
They can't even afford rent, let alone covering health care for themselves or their children. But do you see what they're doing? They're cutting health care for 13.7 million Americans, the largest cut to health care in U.S. history, to give tax cuts to billionaires and to big corporations. This is your priority. Live with it. Defend it. Speak about why it is you are doing this. Because that is the consequence of your actions. Donald Trump told you to do it? Or is this what your constituent asked for?
I can tell you right now, I represent New Jersey. Up and down my state, people are afraid, people are hurting. People who run hospitals, who run clinics are saying there is a tsunami coming to this state and to this nation. We have to stand up and fight right now. This is a time where we all should be coming together to do something to alleviate the rising costs, the loss of health care, and the pain that Americans are about to get hit with.
The government shutdown was just a couple of days ago, but yesterday, October 2nd, I got this letter talking about how my monthly premiums are going to go up for my health insurance. They obviously sent this out before the shutdown even took place in order for me to get it yesterday. So look at this. 2025 monthly payment is $218. They broke it down for me though. Thank you. Here's the math, bitch. Monthly premium of $627 minus $409 of financial help you get each month. That's the Affordable Care Act going away. So $627 is right now. Starting in January, it's going to be $727. So not only did they take away the $409, they increased this motherfucker by $100 a month. What the fuck?
They are absolutely correct, you guys. And right here is a little side-by-side comparison because, you know, MAGA, they love to look at charts and they need something, some sort of picture so that they can really understand things. So this is with the Affordable Cares Act. This is without the Affordable Cares Act. And this is what the Democratic Party was trying to stop before this whole government shutdown because the Republican Party wants to remove the Affordable Cares Act. That's what they want to do. It's not about undocumented migrants getting health care. It is not about that. It is about the lower class and middle class citizens here in the United States of America that can afford health insurance, plain and simple. And here's the other thing, you guys. The job market, the economy, since Donald Trump has taken office, it is the worst economy since peak COVID time. The worst economy. The job market, non-existent. Every single month when they end up releasing the jobs report, guess what? They're not adding new jobs. They're taking away jobs here in America. That is what they are doing. And for those that aren't from America, you guys have to understand this also. A simple hospital visit for someone, if they don't have health insurance, let's say they go to the hospital, they have to go to the emergency room and they're sick and they need urgent care right then and there. A simple visit can literally cost the American person thousands, if not tens of thousands, just going to the hospital. And I know you're thinking, well, just don't pay the bill. Well, here in America, guess what? If you have a job, they will garnish your wages. So now you're making even less money on your paycheck because you ended up having an emergency visit to the hospital. Also, here in America, if you don't have health insurance, and let's say you get taken by an ambulance and everything, let's say you need an ambulance and you call, you're like, yo, I need someone, you know, that right there could be tens of thousands of dollars as well. Let me know your thoughts in your comments over this way, because that is what the Democratic Party is trying to stop with this whole government shutdown.
So Republicans shut down the government because they want to take health care away from millions of people. Even if you believe the lies that this is all about undocumented immigrants. How can you think you're a good person wanting to take away health care from millions of people? How do you call yourself a Christian? Do you really think this is what Jesus would do? Taking
United States each and every day is becoming oligarchy, where we are having a form of government where it's only serving the few rich people. Majority of, the bottom 99%, they have to fend for themselves, and each and every day life becomes so much hard. I'm talking about the recent healthcare crisis that is happening in the United States today. We are seeing a lot of tax cuts that are being done to the oligarchs, but you understand that majority of people that are suffering are normal American citizens, United States citizens. And this has devastating issues in a lot of things. Healthcare marks one of the most important aspects of human life. Human health is as sacred as human life because they are both intertwined. And when you have a government that doesn't prioritize about its own citizens' health, it doesn't prioritize about its own citizens' future. It's about now. It's about what you want to have. It's about how much you want to get from everyone. It's about how you want to scam the people that entrusted you, the people that believe in you. But let's just go into the historical part of it. You ask ourselves this question. Black people are already right, and black people are already analyzed, and black people are already seen where the president of the United States is taking the world to. Today we are seeing this being a one-man circus. He's running it the way he wants. He could wake up in the morning and just come up with something that is going to affect majority of people. But this is the catch. Healthcare system in the United States is really exploiting its own citizens. If you look at the bills that people are paying for just healthcare is skyrocketing, and it's really crazy that people are coming out and complaining about this. One thing that I would honestly love to say is that these are difficult times in the United States, and I think majority of, I'll call them the bottom 99% because we have only the top 1%. To the extent that we are going today, we only have the top 1% and we have the bottom 99%. The bottom 99% of Americans today, they are really having it hard, right? Because their Medicaid, their Medicare being revoked. This means that they need to fend for themselves. Health insurance becoming so much damn expensive for everyone. But the question is, why do you always choose wrong most of the times? People are asking, why are always white people choosing the wrong decisions? Yet they're going to wait for for black people to fend for themselves. They're always waiting for black people to go on the streets for them. Yet they are the ones who chose the wrong direction. Don't get me wrong. We are together in this fight because what's affecting you is also affecting us. But look, why would you just put yourself into the ditch and then you want somebody to get you out? So buckle up for this video. I'm your host and presenter G-Tech Stories, and if you're watching me for the first time, I'm asking you to please subscribe to the channel, join the membership, and really get so I can offer you. But until then, let's watch the video. I'll be back with my thoughts.
away healthcare from fellow Christians. And if you remember the last time the Republicans tried to shut down the government, what was it over? Food stamps. They wanted to take away food disproportionately from hungry kids. How can you think you're on the side of good? How do you call yourself a patriot and yet want to take away healthcare from millions of people? And if your immediate reaction is to go, oh yeah, well the Democrats bad, that's you being defensive because you know deep down.
Shutdown fight has exposed how broken our healthcare system is. Can you believe that premiums are going to go up 100% for 24 million American families if we don't extend the tax credits for the Affordable Care Act? That means tens of thousands of people will go without care, and thousands of people will simply die without care. The reality is we need Medicare for all in this country. Every person from the day they are born should have health care. This is the time to reintroduce the idea of Medicare for all and start to demand that we vote on it in the Capitol.
Thanks very much for joining me. Let's be clear. Our healthcare system today is incredibly broken, dysfunctional, and cruel. 85 million Americans are uninsured or underinsured. We pay the highest prices in the world by far for health care. 1 out of 4 Americans can't afford the outrageous prices of prescription drugs. We don't have enough doctors, nurses, dentists, mental health counselors, or other healthcare professionals. Our life expectancy is already far lower than other major countries. Yes, our healthcare system today is already broken. And in my view, in order to remedy that crisis, we have got to do what every other major country on earth does. Not a radical idea, and that is to guarantee health care to all people as a human right. But what I have to tell you is that in the midst of all of this, the dysfunctionality of the current healthcare system, Donald Trump and his friends are making a horrific situation even worse. In fact, they are pushing our healthcare system over the edge to the verge of collapse. Now, you think your health insurance costs are high right now? You think you're already paying the highest prices in the world for healthcare? Well, guess what? Within the next couple of weeks, millions of Americans are going to get a letter from their insurance companies telling them that their insurance premiums will double. Let me repeat. As a result of Trump's big, beautiful bill and massive cuts to the Affordable Care Act, your health insurance premiums for 24 million Americans are going to double. And maybe even worse, could get worse. As part of that big, beautiful bill, 15 million Americans will be thrown off of Medicaid and the Affordable Care Act. Studies from Yale University and the University of Pennsylvania suggest that when you throw 15 million low-income and working-class people off of the health care they have, some 50,000 people will die unnecessarily every single year. It's not hard to figure out why. If you're low income, you're working class, you're sick, you don't have any health insurance, you can't go to a doctor, you can't get into a hospital, you know what? You're going to die. 50,000 people unnecessarily every single year. But it's not just insurance premiums or getting thrown off the health care that you have. As part of these awful cuts, nursing homes in America are going to be decimated. My office has studied some of this. The nursing home situation in America today is a disaster. They're understaffed. And the way we treat the elderly and disabled who are in nursing homes is something we should be ashamed about. But guess what? When 2 out of 3 people in nursing homes are dependent on Medicaid, that situation is going to become much worse. Rural hospitals are going to be hard hit. Republicans like to talk about investing $50 billion into rural health care. But what they somehow forgot to tell you is that their cuts in the bill are $150 billion. In other words, they put $50 billion in after taking $150 billion out. That's a loss of $100 billion for rural health care. Further, we're talking about community health centers. 32 million Americans, all walks of life, get their health care, primary health care, dental care, mental health counseling, low-cost prescription drugs from community health centers. They are going to be decimated as a result of these cuts. So my friends, this is, in my view, what this government shutdown is all about. Republicans want what they call a clean CR. And what that means, for the first time ever, what they want to do is push forward a bill and get it passed without any Democratic input. Now, in the Senate, the rules are clear. They need 60 votes. And what that means always is there has to be bipartisanship. You want 60 votes, you got to have both parties coming together. Republicans are not doing that. They're not negotiating. They're simply saying, take it or leave it my way or the highway. Well, many of us in Congress are not going to take it. So that is what this whole government shutdown is about. Now, you may not hear much of it from the media, or you may not hear it from most Democrats or Republicans, but that is the simple truth. So let me be as honest as I can be. And that is, I do not intend to vote for legislation that will allow 50,000 Americans to die unnecessarily every single year. Ain't going to get my vote. So let me conclude by asking for your help. I can give all the speeches I want. Other members of Congress can give great speeches. They do fine. But what's more important is that my colleagues hear from you. So right now I am asking people all over this country, including you, you, to share your story. I am the ranking member of the Senate Health, Education, Labor, and Pensions Committee, and I want to hear from you as to what a doubling of your healthcare premiums will mean for you and your family. I want to hear what it will mean if you are one of the 15 million people being thrown off the healthcare you have because of the massive cuts to Medicaid and the Affordable Care Act. I want to hear from you as to what it will mean if you have a family member in a nursing home and that nursing home has got to cut back on staffing because they don't have the funds or maybe even shut down. What does it mean if you're currently visiting a rural health center, you live near a rural hospital?
People deserve free or at least affordable health care, and that shouldn't be a divisive take, but in the United States it is. And Democrats are fighting for millions of Americans to retain at least some semblance of affordable health care, even as Republicans wish to strip it away from Americans. And that's at the crux what this government shutdown is about. Democrats wish to keep people with benefits that otherwise would make certain that they do not have access to affordable health care. And when we say they won't have access to affordable health care, who among us can take an almost $27,000 a year hit? Because that's exactly what's going to happen to the average American utilizing Affordable Care Act subsidies. In the top 5 states, according to a new analysis done, the average cost paid is $2,750 a year with subsidies. Without the subsidies, that average cost is expected to rise to $30,000 for the average family. So you're going to go from just under $216-ish a month to almost or right at $2,500 a month. Who among us can afford that kind of change just to make certain that we and our families are healthy? Because that's what Democrats are fighting for, is to keep money in American citizens' pockets and out of the pockets of billionaire corporations and CEOs. They want to make certain that the middle class and low income are protected, while Republicans want to put more money in billionaires' pockets.
My friend who's retired, I believe she's 67 now, just got her Medicare Advantage premium details for next year. And her out-of-pocket maximum expense went from $4,200 a year to over $10,000. So if she has some kind of emergency where she requires hospitalization or emergency room care on a retiree's income, she gets to pay up to $10,200. This is Republican policy. She lives in the state of Indiana. And this is what all the cuts to everything are doing, all the budget cuts to every state. And these are the decisions each state is making individually on what's going to be cut, who's going to have to pay more. And people think that there's going to be an end to this shutdown. You've got Caroline Leavitt lying, Donald Trump lying about all these people not getting paid, all of these layoffs. They don't give a rat's ass about layoffs. If they did, they would have cared about the 280,000 federal workers who lost their job because the guy who runs X and his little 19-year-olds wanted to give so much more money to the billionaire class in tax cuts that they just stuck it to all of us. They didn't care about those 280,000 employees, former employees. And now we're coming up to nearly 1 million Americans laid off because of the tariffs, because of all the funding cuts, because of all the deportations. Almost 1 million employees. They don't care about them. They don't care about them. And to think that Republicans actually believe this administration cares about the government workers being furloughed right now over this shutdown thing. Macro view. Project 2025 wants the Affordable Care Act completely dismantled. They're gutting it. This is on their way to doing that. Once it's gutted, there'll be no more government subsidies for any of us, meaning our tax dollars being pooled collectively and then dispersed to bring down our healthcare costs. No, instead, they're going to privatize everything. So their cronies are going to make a shit ton of money starting companies that can fill the need, or just giving contracts to the companies that already exist, all those MAGA donors. And nothing will be for us. Everything will be out of pocket. We are fucked. So this shutdown is not going to end because Republicans care about people being laid off, or because they care about how much we're going to be paying for health care. So there you go. In the meanwhile, look for all your premium hikes next year. And now foreclosures, it was just announced, foreclosures are at an all-time high because people can't afford to live in their homes. It's all coming together swimmingly.
Do Democrats want to give illegal immigrants health care at your expense? Is that what the government shutdown fight is all about? Is it really based on a word game that could actually cost Americans hundreds in health care? Here's the trick that President Donald Trump and Vice President J.D. Vance are playing on you. It's a word game trick. Yes, some migrants get health care benefits, but they're not illegal immigrants. They're called lawfully present. They include refugees, asylum seekers, DACA recipients, people with work visas. They have legal status. They pay taxes. They're following the rules. Back in March, Republicans stripped health care from 1.4 million of these legal immigrants in Trump's tax bill. Now the Republicans are calling that same group illegals to make the Democrats look bad for wanting to restore the cuts. And the actual undocumented immigrants, the illegal immigrants, they can only get emergency room care, which is a fraction of 1% of healthcare spending. They can't get Medicaid, they can't get Medicare, or ACA subsidies. That's been the federal law. Since 1996, nothing has changed. Here's what matters to your wallet. Without these ACA subsidies, 24 million American citizens will see premiums jump 75%. That's hundreds of dollars more per month for health insurance for American citizens. So don't fall for a word game. The fight here is about keeping healthcare affordable for Americans.
I pulled a Republican aside on the floor and I said, hey man, there's no cameras around here. I just want to understand. Like, I'm not here to put you on blast in front of a camera, just person to person. I genuinely want to understand, because people think that trying to understand another person means that you agree with them or that you're being soft on them. And it's a huge problem in this day and age, because that mentality really prevents people from being able to connect and persuade. But I pulled this guy aside and I said, hey man, like, I know that you represent a couple of rural hospitals, and this bill is going to devastate rural hospitals. I just want to know from your perspective, are you worried about that? What are you thinking about with your hospitals and your people? Because a lot of people don't know, like a ton of ACA recipients are in red states. A lot of Medicaid recipients are in red states. These are like Trump voters that are almost disproportionately, in many circumstances, being negatively affected. And so I said, like, walk me through how you see this. And he was like, yeah, I just don't believe it. He's like, I know that you guys need to make a big deal out of this to like score political points, but I just don't believe it. And I'm kind of sitting here like, this data shows that this bill is going to devastate a lot of people. But a lot of these folks just like don't believe that data. You know, there was one hospital in one of these districts I was like, yeah, we might have to close. And they are now on their back foot. Like they thought this was just a Democratic talking point. And now that their own people are being affected and their own hospitals are warning them, they are now kind of low-key panicking.
Let me repeat that. I know it sounds amazing, but it is true, and it's understandable. If you're throwing 15 million low-income and working-class people, many of them with serious health problems, off their health care, they can't get to a doctor when they need to. It is not shocking to understand, or surprising to understand, that 50,000 of them will die unnecessarily every single year. That's what we're looking at. And then on top of all that, the Republican bill also cuts tax credits for the Affordable Care Act. A study just came out yesterday from the Kaiser Family Foundation, a nonprofit healthcare organization, and its findings are pretty clear. Within the next several months, healthcare premiums for 20 million Americans on the Affordable Care Act will double. Got that? Double. So you think that right now you're paying an outrageous amount for healthcare, and you are. And right now you can't afford healthcare, and many of you can't. Under the Republican proposal, your premiums will, on average, double. This is insane. It is unacceptable. In other words, instead of lowering healthcare costs, instead of adding more people to healthcare, cutting back on the number of people who are uninsured or underinsured, what Trump's legislation does is make a terrible situation much worse. So don't get confused. I know there's a lot of stuff in the media, and a lot of people in both political parties are arguing with each other and blaming each other. But to me, what is going on is really not complicated. And that is, if we do what the Republicans want us to do and pass a clean CR with no input at all from the opposition, if we just do that, 15 million Americans will lose their health insurance and tens of thousands will die unnecessarily every single year. If we pass the Republican legislation, your premiums will likely double in the very, very near future. Needless to say, I do not intend to support the Republican proposal.
Our government is giving that government billions of dollars to blow them up while telling us they don't have any money to raise the minimum wage. So you think that fighting for healthcare in America has nothing to do with how free healthcare is given to a country that gets billions of dollars from Americans? Let's really talk about this. Let's really think about this. So in America, there is an entire big budget. The budget is allocated to different issues that America finds important. We give metaphorical pennies and cents to Americans, especially Black Americans, when it comes to healthcare and when it comes to education. Our government can give billions of dollars to an international entity while telling us during the campaign they don't have money for us. But I'm the one crazy and focused on the way hit. It don't even make sense. Don't even make sense at all. They don't have money for insulin. They didn't have money to make sure they ain't have money for all this shit, but they got money for this, and you mad at me. So during the campaign, was we or was we not talking about education and healthcare? During the campaign, did we not explicitly talk about how Project 2025 would impact healthcare and public education? Did we? Why are you getting mad that during the election, I talked about how there were also funds taken away from our public education and healthcare that was going to a public foreign entity, and you got mad at me? How that make sense? We can't focus on Palestine. We got to focus on us. They giving money to blow up Palestinians over you having food to eat. They giving more money to them over there so me and you can fight about student loan debt. What they got done, y'all being unfair. Stop bullshitting me. That's what it is too. A lot of y'all that's the loudest about this, you don't do no work and you don't know shit.
The reason the government is shut down is all over Obamacare subsidies that expire at the end of the year. Yeah, I mean, the Democrat ask was initially for some other things as well, but we can focus on this. Explain the subsidies. Yeah, so one of the tenets of Obamacare is premium tax credits that were initially confined only to those whose income was between 100% and 400% of the federal poverty level. So in 2014, when the ACA passed, anyone making between roughly $11,000 and $50,000 a year who bought healthcare on the ACA marketplace were given tax credits that ensured their premiums stayed between 2 to 9.8% of their income, depending on how much they made. Yeah, and then during COVID, Biden signed the American Rescue Plan in 2021 that expanded these tax credits to anyone on ACA healthcare, regardless if you're making more than the 400% of the federal poverty level. So this capped everyone's premiums at 8.5% and also increased subsidies even more than before for those making less than the 400% federal poverty level. Yeah, but those changes were set to expire in 2022, but then Biden signed the Inflation Reduction Act, which extended these new subsidies even further until the end of 2025, and that's what we're approaching. Well, Democrats had all three chambers of government when they added these subsidies, and even they decided to make them temporary, as these were always supposed to be temporary COVID relief programs. But now too many Americans' livelihoods are dependent on these subsidies. Studies suggest if they go away, over 4 million Americans will become uninsured because ACA premiums will more than double, which is why even MAGA people like Marjorie Taylor Greene has said she will back extending these subsidies, as she has realized millions of Americans, along with her own adult children, will have their premiums double without them. Well, a couple things here. First off, if these subsidies go away, all that happens is back to the initial ACA subsidy rules, the way it was from 2014 to 2021, the way Obama intended it. And second off, these subsidies end at the end of the year. Republicans have said they're willing to negotiate them, but shutting down the government 2 months before their elimination and using federal workers and services as pawns is not the way to proceed. Well, it's because the subsidies need to be extended now, as insurance companies are forward-looking, and many are already raising premiums in anticipation of subsidies being removed, as it would kick people out of the market and they will lose business. And that's the other thing. Both Republicans and Democrats want cheaper healthcare. There's just a difference of philosophy in how we get there. We think the way is less government involvement and free market forces. There's a reason why insurance companies and universities love all these government subsidies, because it allows them to raise prices exponentially and in ways they wouldn't be able to do in a free market system, as the government, which is the taxpayer, is the one paying the increase. Well, then what's your plan to ensure on January 1st, 2026, millions of Americans don't lose their insurance because of doubling premiums? I mean, Democrats have acknowledged Obamacare isn't perfect and we are willing to negotiate changes, but I mean, shit, I think we want to go the opposite direction, closer to a Medicare for all system. But right now, the focus should be ensuring millions of Americans aren't screwed at the end of the year. Yeah, and we are willing to have that negotiation too with an open government. And I think we can admit Obamacare has failed. Premiums and deductibles have risen and you actually can't keep your doctor. So I think the American people want a different solution other than just continuing to feed this beast, which if these subsidies are continued, will cost the taxpayer, according to the CBO, over $335 billion over the next 10 years, which I'm sorry is money we don't have and therefore is paid through inflation. Well, I'm sorry, I think if we're going to deficit spending on healthcare for Americans is the most noble way to do so. When Obamacare has cut the uninsured rate in our country nearly in half, and millions of Americans will feel pain if part of it is eliminated at year end, so tread carefully. Open the government and we can talk.
Democrats in the Senate voted to keep the government closed for the remainder of the weekend, and the question is, are there actually illegal aliens receiving Medicaid? That whole thing is the impetus of our shutdown. And whether you like this or not, it's an undisputed fact that under the Biden administration, there were undocumented immigrants receiving taxpayer-funded health care. Here are the facts. Last year, Medicaid costs for emergency services for illegal aliens skyrocketed 142%, totaling $9.1 billion. From 2020 to 2024, Medicaid spending for emergency services for illegals tripled under Joe Biden, up 196%. In 2023, under the Biden administration, South California's, and I quote, entire healthcare system was being bombarded by illegal aliens, enforcing American citizens to endure longer wait times. In Denver, Colorado, the CEO of Denver Health stated that 8,000 illegal immigrants made 20,000 visits to the city's health center in 2023. That all left an uncompensated bill totaling over $10 million. The Congressional Budget Office estimates that there are about 1.2 million illegal immigrants receiving Medicaid. Those are just a few examples. So that's why in the one big beautiful bill that was passed a few months ago, the Trump administration and Republicans made sure that those who are not American citizens were not receiving free taxpayer-funded health. Democrats want to add all that money back and give people who did not deserve free health care free health care. If somebody says to you there are no illegal aliens receiving Medicaid, you show them this.
We all have to get behind the Democrats calling for a shutdown. And Trump supporters, I am talking to you too. We need the Affordable Care Act subsidies to become permanent. And over 50 conservative groups are urging Trump to let them expire. And let me tell you, this is one example of the math. A couple who are 55 years old, collectively bringing in $85,000 a year, currently pay, on average, in healthcare premiums $7,500 a year. If these Affordable Care Act subsidies expire, their premium, are you listening to me, Trump supporters? Their premium jumps to $24,000 a year. So while the billionaire class continues to become ungodly wealthy under this administration, private healthcare insurers and all of their executives are going to make a shit ton of money because they'll get to charge you another $17,000 a year. Just a couple making $85,000 a year. A lot of us don't make that much. Who can afford to have 25% of their income go to healthcare premiums? We're just going to become uninsured. No one's going to be able to afford that. Are you ready for this, Trump supporters? Instead of owning the libs, can we not all get together and agree this is really, really, really bad and it's okay to jump sides one issue at a time?
Hello brothers and sisters, welcome back to the channel. I'm hoping that you're doing great from wherever you watch me from. Again, I'm your host and presenter Agent Stories, and I'm really glad that we have this platform and we can talk about all these issues that I feel like they are important. First things first that I like to say is that why do we always have white people that all sabotage for themselves and sabotage for the entire group of people? Just because you decided to choose racism, just because you decided to choose fascism, you know that this is affecting innocent people. What about the old white your grandparent that didn't go to vote? You know how this is affecting him, right? What about your kid? This is affecting him. He didn't go to vote, but you're the one who chose this choice. Who chose this choice? Doesn't that make sense to you that you have to wake up every morning and each month the prices and rates of everything keeps on increasing just because you decided to sabotage it for yourself? You understand what I'm saying? So it becomes so much difficult when we try to analyze all these issues. Americans are putting on a fight, and you can see definitely Americans are putting on a fight, and I know that these will be fruitful. But let's just have a discussion on important things. The fact that white people decided to vote and decided to choose racism because they wanted, at the back of their mind, I believe they wanted to protect what is called their white supremacy. They wanted to protect what they called, what they think is right, because at the end of the day, that's what they were told. That was a lie that they were sold to. And so when you understand you're moving as a blind person, you don't have direction. But remember, black people didn't trust the system. They have never trusted the system. And they tried to warn some of you all, but you didn't listen. And some of you went to an extent thinking and saying that since it is a black person, you can't even give him credit. You can't even give him your airtime, because what does a black person has to say about geopolitical issues that are happening in the United States? They have nothing to say. So that's what you believe. Because at the end of the day, you are taught in your house that black people have nothing great to say. But this is just one thing that they warned you about, and they try to tell you to brace yourself for all these things that were coming, but you didn't see it as important. You didn't even check it as it's something which is useful. But until it affected you, that's when you saw that this is important. One of the most things that Americans are learning today, that the government is robbing them, is their healthcare systems. For example, when you try to compare the healthcare system in China versus the healthcare system in United States versus the healthcare system in India, you're going to see there is a similar pattern between the healthcare system between China and India. But the United States, when you look at its curve, it takes a dip, which means that there is a huge reduced healthcare services to the people of United States. And this is affecting them. Remember, I told you that 90% of the lives that people are living, talking about things like mortality rates, talking about things like, age limits that people have, so these are all important parameters that are being controlled by the healthcare system of a country. Countries that have lower healthcare system reports high death rates, reports low, how do we call it? They report low, I think I'm forgetting this term, like low mortality rates, like, you understand. And so there are chances of survival of people in these countries, and the United States is part and parcel of all these. And the price that white Americans are paying is the price of ignoring a black person, is the price of not listening to a black person. Just because a person is a black person, it doesn't mean that they have nothing great that they can say, right? Look, I'm not so much into Democrats. I'm not so much into Republicans. I don't subscribe to all those people because at the end of the day, they are pushing their own agendas, some of them that I don't agree with, both sides. But let's just be careful. Let's just be keen. Because when black people try to warn you that this was going to happen, you didn't listen to them. Well, in fact, you took it for granted. You can't listen to a black person because what can a black person tell you? But here we are. People are complaining about health insurance. People are complaining. People have to fend for themselves when they can't even pay their rents. They have to pay for their health. And you've seen all these people living in cars because it's getting crazier. And you want to tell me that this person has money for their health? They don't have. It doesn't make sense. And you went ahead and make it so much difficult for them. Make it difficult for yourself. While you sabotage it for black people, while you sabotage it for all other these minority groups, remember you also sabotage for yourself because it's backfiring and coming back to you. It's happening to you in real time, and this is what is happening, right? So, I really don't know what's wrong with people, especially poor whites. They're the ones who will always run to make the wrong decision, make decisions that they'll come and regret later. And right now, they are regretting. They are saying, I wish I knew. I wish I knew I made the right decision. I wish I knew I'd listened to black people. I wish I knew we had joined hands with black people when it was still early. While it's still late. You can't make the A's. The sunshine is gone. But what can you do? The important lesson that you can have is to learn from this experience and never trust a person because they are looking like you. Don't trust them. Majority of you voted overwhelmingly because, the president was looking like you. You didn't listen to the agendas. You listened to the white supremacy. You listen to what you could get out of it. You listen to how you'll benefit from out of it because you thought that it was only going to benefit you and it was not going to benefit other people. That's why you went that way and you made decisions overwhelmingly because you knew at the end of the day it's going to benefit you. Well, there you have it. So brothers and sisters, please let me know what you think and feel about this video. But until then, let me see you in my next video. Peace, love, and harmony. Salute.